Thank you, Madam Chair. I would want to put into context some of the issues and some of the challenges that countries may face in trying to link health, nutrition, and agriculture, and try to do all this in 5 minutes. We know that in recent times, many international, regional, national, and sector policies and frameworks have been developed, and they all seek to address the multidimensional nature of nutrition and stress the need for all stakeholders to collaborate and coordinate their efforts. And I would like to take a few examples. Some of them the Chair has already indicated. But going back to the Africa Union Nutrition Strategy of 2005 to 2015, a 10-year strategy, there is an objective there that there is the need to define mechanisms for collaboration and coordination among the various actors concerned with food and nutrition problems at national, regional, and international levels. That's one of the policies. If we take the Framework for African Food Security, FAFS, which is Pillar 3 of CAADP, it also recognizes that it is necessary to ensure that all parties and players automatically seek to understand and address hunger and nutrition. That's at the continental level, and these are only 2 frameworks that I've quoted here. Now, if we come to my own country, Ghana, and I'll be using Ghana as the examples in most of the issues that I'll bring up. In Ghana, over the years, several national and sector policies and plans have addressed the need to link nutrition and agriculture. At the national level, apart from national development plans such as Ghana Vision 2020, which was developed some time back, the Ghana Poverty Reduction Strategies 1 and 2, and other sector plans have also indicated the need for collaboration. Ghana Vision 2020 recognizes that nutrition is key and that it should be mainstreamed across different sectors, and so does the poverty reduction strategy. If we come to the various sectors, we have the Health Sector Medium-Term Development Plan, 2010 to 2013, and it states, and I quote, that in order to address the identified challenges, the sector will collaborate with Ministry of Food and Agriculture in food security, the fortification and targeting of food supplements, and create awareness on proper nutrition in targeted population. Now, if we come to the agricultural sector in the same country, the FASDEP, which is the Agricultural Sector Plan, 2009 to 2015, states, and I quote, that there is a recognition that there is need to give support to improved nutrition because there are several nutrient-rich foodstuffs whose production and consumption can be promoted alongside fortification technologies to get the best out of nutrients. And they even go ahead with a target and says that the target is that stunting and underweight in children, as well as vitamin A, iron, and iodine deficiencies in children and women of reproductive age would be reduced by 50% by 2015. So really, there are policies. The issue of collaboration is addressed in policies at the continental level and at the country levels. So what does it take to put it into action? And I've recognized 2 main challenges, and this is because of time. The first challenge is the national level structures. Who is best placed to coordinate health and nutrition? And we have to recognize that agriculture and health sectors are huge. They have huge challenges, and usually nutrition falls between the cracks. For example, if there is an outbreak or something just now, the health sector will move to address that problem. and may not look at the nutrition implications in doing that. And so is the agricultural sector. So the first challenge that I recognize is to identify a national agency which has the mandate of bringing the two principal sectors, health and agriculture, together. An agency that is capable of ensuring that linkages in these sector planning processes happen and makes effort to ensure integration. An agency that has the muscle to pull the big policymakers in health and agriculture to sit down and talk together. Coming to my country, we did a project a few years back where we linked nutrition and agriculture. And what we did was that in order to ensure the linkage, especially at the district level, because of the decentralization process and because of the way we plan and budget in the country, we picked an organization that had the muscle to talk to the district level and say, look, this is what is needed. This is what we've got to do. And put in the resources necessary to do that. And that was our National Development Planning Commission. It proved to be an effective organization in bringing the two sectors together. So that is the first challenge. How do you identify? And I'm sure in many countries, they have such structures there. That is at the national level, identification of maybe a sector which will champion the cause of nutrition. Now, if we come to the sub-regional level, and because Ghana is in ECOWAS, I'll use ECOWAS as the example. ECOWAS, I believe, has the health wing organized by WAHO, West African Health Organization, and then it has also agriculture wing. And I believe the name is ECOWAP. Even at my level, I don't even know the name properly. Now, WAHO is in Burkina Faso, and ECOWAP is in Nigeria. How do we get them to talk? And we also recognize that at ECOWAS level, there are meetings of ministers of health. There are meetings of ministers of agriculture. Before the ministers meet, the technical people from these two countries meet for about a week. Health meets on its own. The technical people in health meet on their own. The technical people in agriculture meet on their own, and they come up with their own communiques, not talking at cross purposes. The challenge is that if integration is not seen at the sub-regional levels, we do not see, there may be some collaboration, I don't know, but if it is not obvious to countries at that level, how do you expect countries to be able to address at their country level? So the second challenge at the sub-regional level is to ensure that at least health, and when I say health, it's because in Ghana, nutrition is in health. And therefore, the appropriate technical people take part in some of these discussions at the sub-regional level. And it will be an example for other countries to follow and know that, yes, as a Minister of Health, as a Minister of Agriculture, when we are planning at our country level, we have to collaborate at that level. Now, there are a few suggestions that I would want to make to move this forward. My first suggestion, or my first recommendation, and we all know it, is the need. In fact, my priority number one is advocacy. My priority number two is more advocacy. My priority number three is continuous advocacy. Continuous advocacy because people change. Ministers change. Even technical people change. Some get transferred. Some join other agencies. And there is need for that continuous advocacy. And one advocacy doesn't fit all levels. We have to use evidence-based advocacy some for the regional level, the sub-regional level, even at the country level, at the ministerial levels, and also at the community level, so that communities make demand for some of the nutrition services and programs. And having nutrition in a sentence or two with the word nutrition inserted into policy documents and framework is only the first step. We would need constant advocacy and an agency, as I've said, an institution in the country which can bring the two sectors together. My second recommendation is that let us use the nutrition lens approach. The nutrition lens, gender people, they sat down and thought and they said, let's create something called gender lens. And they use this lens to ensure that gender issues are addressed in every program. There is a nutrition lens. It's a tool that allows for coordination, that allows for monitoring, and that ensures that nutrition issues are addressed in different programs. Let us use the nutrition lens by the agriculturists, by the nutritionists, by the health people, and let the national agency also get well-versed in the nutrition lens so that they can use it for the sectoral programs and the activities that are planned at the country level. Madam Chair, thank you for this opportunity.